This presentation is an example to help you learn how to select the correct E&M code. The first step is to determine the place of service the patient was seen. Examples would be in the office, hospital, home, or emergency room. Review the documentation to find the correct place of service. The second step is to verify the type of service performed. Was it an office visit, a consultation? If it was in the hospital, was the initial hospital visit or a subsequent hospital visit? Was it critical care or newborn care? The third step is to find the category in the E&M index within your CPT manual. This will help direct you to the section of codes that you will be looking for. Step 4 is to determine the patient status. Was the patient a new patient or an established patient? Were they outpatient or inpatient? Step 5, find the section of codes within the E&M chapter. There should be a variety of code levels depending on the section you are in. Step 6, select the code based on one of the following: key components or contributing factors. The first image shows an example of a code showing the key components, which are history, exam, and medical decision making. The second picture shows an example of contributing factors. This code has time in the description. The final step is to verify the type of service, the place of service, the patient status, and make sure you read the description of the code carefully to make sure you are following all guidelines. If it was the key components, did you meet the guidelines for new patient versus an established patient? If it's time, make sure you verify the total time and use add-on codes appropriately. If it's for a physical exam, these are based on age. An example: a 53-year-old patient was sent to a surgeon for an office consultation concerning bleeding internal hemorrhoids. A problem-focused history and exam were performed. The consultant recommended treating with medication after a straightforward MDM. I have underlined the specific things you need to watch for. The type of service is a consultation. The place of service is an office. Patient status is not mentioned, but consultations do not have a category for new versus established, only office or outpatient versus inpatient, and this was already mentioned as being in the office. Key components are listed. It is the problem-focused history and exam and straightforward medical decision making. Therefore, your code would be 99241.